Hi guys, my other chat that I was just on somehow got disconnected, so I am starting a new one and picking up where I left off. I hope some of you can join me. There were a lot of comments that I didn't get to respond to, so hopefully some of you will leave me comments on this new thread. I apologize for that. It's the connectivity here is pretty bad because of the weather. So what I was talking about is a new drug by a Russian biotech and pharmaceutical company called R-Pharm. They have a new RA drug in stage 3 of clinical trials. It sounds really promising. And I guess my whole point with that was not only to promote my new Healthline article, but also just that, new things are in the pipeline all the time. So we can't give up hope. There are things out there, so we can keep hopeful for the future that there will be a treatment that works for us, or there will be an eventual cure. I wish there was a way to go back and get the comments from the previous video chat. I don't know how to do that without closing out of this. I'm so sorry that the connection got lost on the first part of this chat. It's raining really badly here. It's been storming all afternoon, so I do apologize for that. And my hair. That's why my hair is all soaking wet because of this lovely weather, and that's why the other part of my chat went out. But I will go through and personally answer, the comments that were on the thread. I'll write back to them on Facebook. Now, if anyone is on this particular chat, part 2 of chat 3, I guess, feel free to leave a comment or ask me a question. I would love to address any comments or questions. Again, for anyone who's newly joining us, this is part 2 of chat 3 that just started at 4:15 this afternoon. Part 1, I lost the connection due to the weather, and so that part of the chat went bye-byes, but I am here. It is 4:45 almost, and thank you, Christy, for chiming in. I'm glad people are finding me and realized to get off the old chat and come on to this one. I lost connection, but thanks, Christy. Christy Staley says that she's on Enbrel and methotrexate. She said they're pulling her off the methotrexate 8 pills a week down to 3 a week now, and she's having some difficulties with that. Christy Staley, I hope I'm pronouncing your name correctly, and I apologize if I'm not, but you asked any idea what they will do now. Honestly, I don't know. I couldn't answer that because I'm not a medical doctor, but I will say that there are other options of drugs that are similar to methotrexate. I want to say Imuran and sulfasalazine are sometimes given in lieu of methotrexate, if methotrexate fails or doesn't work or whatever. So you may keep an eye out for those and maybe do a little research on those in case that's what you get prescribed. I've been on both of them. I've been on methotrexate too. I can't say whether or not you'll have luck with either one of those. As you know, we're all different and we all respond differently to these drugs, so I'm not sure what they'll put you on. Some people just get pulled off of methotrexate altogether and will stay on a biologic without methotrexate. In some cases, a methotrexate isn't required. It's just kind of an additional piece of the arsenal, if you will. It's just like an extra thing that they're trying to combat this disease, but it's not always required or necessary. So sometimes when they pull people off methotrexate, let me start over there. Sometimes when they pull people off methotrexate, they just don't substitute anything. Other times they will pull you off methotrexate and put you on something like Imuran or azolfidine or another DMARD, which is a disease-modifying drug. Hi, Nigel. Nigel said that methotrexate gave him infections constantly at 12 tabs a week, and Enbrel did the same. So I can relate to that. Methotrexate is a really, really harsh drug. And I think that it's probably one of the hardest ones that RA patients have to kind of deal with as far as side effects and everything. You know, it's hard, but it does help a lot of people and it works for a lot of people. But yeah, methotrexate's tough and the biologics are tough. You are certainly more prone to infections when you're on these types of medications. And that's, you know, that's difficult. So that's something that you always have to be careful of and be mindful of and aware of when you're navigating a life with autoimmune illness. You know, when you're on drugs that suppress your immune system, you might derive benefit from them, but there's also that slight risk that, you know, comes along with them, and that includes risk for heightened infection. So you said, Nigel, that you're on sulfasalazine. Yeah. So that sounds like it's in that same family of being a DMARD that sometimes they give in conjunction with a biologic or in place of methotrexate. So yeah, there's a lot of different combos of drugs out there. It's always just a matter of finding what works for you personally and, you know, trying to weigh if the drug's benefits outweigh the risks. Like, is it helping you enough to be worth it? And that's a question that I always ask myself and that I encourage other patients to ask themselves as well. If something is not helping you and it's only making you sicker, then it might be time to talk to your doctor about trying another route. There are lots of alternatives out there and there's lots of drugs out there, and sadly sometimes doctors only recommend certain ones to you because they're getting a kickback. You know, for better or for worse, that's the way our healthcare system is. So just be aware that you're in charge of your treatment journey and, you know, educate yourself on all the options, pharmaceutical and natural and alternative, and, you know, you get to decide which of those things you try and if you're doing a combination of them or what have you. So just remember, you're in the driver's seat of your treatment, and there might be some bumps and roadblocks along the way, but hopefully, you know, working with your doctor and any other healthcare providers that you work with, hopefully in cooperation with them, you can find what works for you. And, you know, like I alluded to before, sometimes what works for you may only work temporarily, and then you have to, you know, back to square one. And I'm kind of stuck right now between a rock and a hard place with my treatment, so I get it. I need to really figure that out myself, so I will keep you all updated on that, and I certainly love to hear about your journeys. And I'm gonna be signing off here soon. The weather's clearing up slightly. I know it doesn't look like it, but yeah, it's clearing up a little bit, so I think I will finally make my way home today and just rest and relax the rest of the day, because as I mentioned, not feeling so hot today. Very much looking forward to getting home and putting on my sweats and relaxing with my dogs and my cats and my husband. So I'm happy to stay on for a little bit longer if anybody else has any questions or comments. And just to reiterate what I was talking about in part 1 of the chat, kind of in summary, what I talked about was the fact that I got caught in a rainstorm. It's why my hair is soaking wet, and it's also probably why the weather's probably why I'm not feeling great. But mainly I talked about Gigi Golnesa from the Shaws of Sunset and how her peers and her friends are not taking her seriously because she doesn't look sick. So I talked about that a little bit, and I talked about using the word chemo in regards to RA treatment and how that can and should be applied, and how sometimes it can be a disservice to the community. So I encourage people to, if they're using the word chemo, to be using it properly. And tying it back into the Shaws of Sunset and Gigi's story, she is using it properly. But I have encountered some people with RA who are not using it properly and correctly or with the right intentions. And I think that can sometimes be counterproductive counterproductive and a disservice to all of us. So I would just encourage care and mindfulness when people are talking about their treatments, that they are not misleading anybody, intentional or not. I then went on to talk about the treatments that I have tried, and for both my migraines and my RA. And I wanted to reiterate, since this was in the first part of the chat before we got disconnected, that I recommended the essential oils. In all transparency and all honesty, I do sell them, but don't get me wrong, the reason I got into selling them is because I use them religiously, and I think they are absolutely wonderful. They've worked wonders for me, and at times the essential oils have actually helped me almost more than some of my conventional RA and migraine treatments. So if any of you have questions about essential oils or want to try them, be sure to reach out to me. You can also visit http, it's is.gd/ashdoterra. And I will put that link up on both this part of the chat and chat one once we finish. And the other thing I encourage you guys to check out is my latest article on healthline.com. My latest Healthline article is about the Russian pharmaceutical company R-Pharm and their latest RA drug that they have in phase 3 of clinical trials that looks really promising and hopeful for us. So I'll post that link again too. Let's see, there's nothing else really that I had wanted to talk about today. I guess just I need some encouragement today. I'm just not feeling great between my headaches and my migraines and my dystonia, which is basically muscle spasms that are extremely painful, and my RA flares. I could use some positive vibes today with that, and also I could use some encouragement in trying to figure out the next steps in my treatment plan. Like I said, I haven't been great lately with being complicit in, drug compliance. I haven't been taking all my meds as I'm supposed to, and that's my fault, and I take responsibility for that. I'm totally accountable for that, and sometimes it's by choice, sometimes I just forget. Really, it's just been me being stubborn lately. I'm kind of just over the doctors, and I'm over the drugs, and I'm kind of just wanting a little bit of a fresh start, but it's exhausting, as you guys know. So trust me, I will be taking some meds today. I really had to push myself today to get up, dress up, show up, and never give up. I had a coffee meeting that I went to with wet hair and no makeup, with a new friend who wanted some business advice. And then I met one of my best friends for lunch. Her birthday's this weekend, and I wanted to treat her to lunch, so I definitely didn't want to back out of that. And I had some errands to run. Just look why I'm in the parking lot of a Petco, because I had to get some stuff for my dogs and cats. But I think I'm going to put my other errands on the back burner now and just head home. The rest of my errands can wait, and my work can wait, luckily. And I have a vacation coming up in a week or so. I'll be at the beach for like 12 days. So that is much needed, and I really, really need it. And I hope during that time that I'll be able to really reflect on what the next step in my journey is as far as managing these illnesses. It's been 22 years since I was first diagnosed with RA, and I've had dozens of other diagnoses since then, and it's really hard. I stay very positive, and I encourage other people to stay positive, but I would totally be lying if I said it was easy. So some days are harder than others, and today and yesterday were kind of hard days. It's been sort of a tough week, but I try not to let these illnesses consume me, and so I still wanted to move on with my day and stick to my plans, and that included this chat. So I thank all of you for joining me, because it would have been really disappointing to kind of force myself to get gung-ho and do the live chat and then have no one tune in. So it's nice that so many of you tuned in. I apologize that some of you commented on the first part of the chat and I wasn't able to respond because I lost connection, but I will go back through that when I get off here, and I'll be sure to respond to you. But thank you so much, Christy Christy said, "You are so awesome. Stay strong. Love, light, and warmth going your way." Christy, thank you so much. That really means a lot to me. I definitely could use the warmth. I'm kind of cold since I got rained on. But yeah, the love and the light and the warmth, they're all going right here to my heart, and I hold on to that, and I'm very grateful for that. And I thank you all for joining me today. I'm grateful for all of you. I love hearing your stories. I love hearing your feedback. I guess I gotta give my books a quick plug again before I sign off. I would be a really bad author if I didn't, so be sure to check out my books. They're all available on Amazon, Barnes & Noble, Kindle, Nook, etc. One is called To Exist. It's a fiction novel. One is called Sick Idiot. It is a humorous health memoir. And one is called Chronically Positive. It is an uplifting, inspiring, but real, raw, and honest collection of short essays and my most popular Arthritis Ashley blog posts. I will post the links to my essential oils and also to my latest healthline.com article about the new RA drug. And thank you all for joining me. If you missed part 1 of this chat, it is available. Sorry it got cut off. That's what happens when you live in rainy Pittsburgh. Believe it or not, it doesn't rain every day. Just seems like it rains on the days I do these chats. So I apologize for that. I wish you all well, and I hope that you have a relatively healthy and pain-free evening, and stay well until we chat again. Have a good one. Thanks, guys. Bye.